introduce to Dr. Sam Awan. He is a board certified dermatologist, certified by the American Board of Dermatology, and is in private practice in the Dallas suburbs. He completed medical school at the University of Illinois and dermatology residence at the University of Connecticut. He practices general medicine dermatology with an emphasis on early skin detection through the use of dermoscopy, as well as treating skin side effects from new cancer therapies. So Dr. Awan, thank you so much for having us, and I'll let you share what you have to say to us today.
Great, thanks Sam. Welcome everyone. Like Sam said, my name is Sam Awan. I am a dermatologist. I'm in private practice out of Plano and McKinney, Texas. And I'm excited to speak to you all today on behalf of AIM. Today's talk is primarily aimed for patients with a history of melanoma or family members of melanoma patients. Now, I realize some people watching have been diagnosed for a very long time and have already done quite a bit of research into melanoma, but there's also people tuning in who have been recently diagnosed and are still in the early stages of gathering information. So I'm going to make sure today's talk covers both audiences. We're going to cover some basic and advanced concepts today. I'll give you a little glimpse as to what I look for as a dermatologist when diagnosing melanoma, and we'll make sure that we give you some actionable steps that you can implement to mitigate your risk of skin cancer moving forward. So let's get into it. This is a roadmap of where we're going today. So first, we're going to start out by making sure everyone has a firm grasp of melanoma, what it is, what increases your risk for it, okay? We'll talk about how to detect melanoma at an early stage, both from my vantage point and also little clues and signs that you can look for to make sure you are picking up on the right subtle signs. And then I'm going to spend a little bit of time on sunscreen. Sunscreen is important for everyone, but especially so for patients with a history of skin cancer. There is a lot of hype, a lot of controversy. And so what I want to do today is separate fact from fiction. We'll take an evidence-based look and we'll talk about why sunscreen is so important moving forward. So let's start with the absolute basics. What is melanoma? Well, malignancies are abnormal growths of a certain type of cell in your body. So the three most common types of skin cancer are basal cells, squamous cells, and melanoma in decreasing order of frequency. Now, if you look at a cross-section of the skin, you'll see that the skin has three layers: the epidermis up top, the dermis in the middle, and the subcutis or the fat below that. For today's talk, the epidermis is going to be the most important. So if you zoom in on the epidermis, you'll see that it's made up of different types of cells. These flat cells up here are called squamous cells. So a squamous cell skin cancer is a skin cancer that develops from these cells. This purple row of square cells lining up at the bottom are called basal cells, and that's where basal cell skin cancers come from. And interspersed throughout the epidermis are these funny shaped cells called melanocytes. So melanocytes are the type of cell that produce melanin or pigment, and this is where melanoma arises from. The reason I bring this up, the reason I think this slide is important, is one of the more common questions that I get in my clinic are when we diagnose a basal or a squamous cell, patients will often ask me, if we had left this there for 3 or 4 more years, could it have turned into a melanoma? And the answer is no. These are three completely different types of skin cancer. They have different origins and they behave very differently. So this is a cartoon schematic of what your skin looks like. This is an actual biopsy. So this is what we see when we take your skin, take a biopsy and look at it underneath a microscope. This is the epidermis from the top here all the way down to the bottom of the purple layer. And if you look closely, you'll see those square basal cells lining up along the bottom, as well as those flat squamous cells higher up. The melanocytes are a little bit more difficult to see. Now this is normal skin, but if you look on the right, this is a biopsy of what melanoma looks like underneath the microscope. And if you think big picture, you'll see that this just looks a little bit more chaotic than the slide on the left. The cells are a little bit bigger, a little bit funkier looking. You'll also notice that all of the abnormal cells are limited to that top layer, the epidermis, that purple area. So this was a melanoma that was caught quite early. So big picture, melanoma is, by most estimates, the 5th most common malignancy in the US. It is on the rise in adults, both in the US and around the world. This is not an American-only problem. We are seeing rising rates of melanoma in many different countries. Now, the interesting thing is, in the last couple of years, there have been a few studies that are suggesting melanoma is decreasing in young people, in people under the age of 20. We don't know why that is. Some people have guessed or theorized that it's due to more public awareness about sunscreen and sun protection and the dangers of indoor tanning, but we don't know for sure. What I do know is trends like this are encouraging, especially for groups like AIM, which are really dedicated to increasing awareness of skin cancer and melanoma around the world. So who can get melanoma? Who's at risk for melanoma? The short answer is just about anyone. It is a myth that people with skin of color cannot develop melanoma, but it is true that there are certain things that put you at higher risk for developing melanoma. So I want to take just a second to go into a few of those risk factors. The most obvious is if you've had melanoma in the past, you have somewhere between a 2 to an 8% chance of developing melanoma again. This is why it is so key for patients with melanoma to keep all their appointments, keep up with their regular skin check schedule, and let their dermatologist know if they see any moles that look funny or changing. A family history of melanoma does put you at higher risk. That's even more so when it's a first-degree relative or multiple first-degree relatives. There are certain genetic mutations that can put you at higher risk for melanoma. I'm not going to go into that in detail. We have a fantastic geneticist speaking in part 2 who can do much better justice to that than I can. Lighter skin, so Irish skin, easy to freckle skin, red hair, all puts you at higher risk. The immune system is a very important defense against not just infection, but also malignancy. And so people who are immunosuppressed for whatever reason are at higher risk. And one interesting thing is there are several studies that suggest the more moles you have, the more at risk of melanoma you are. So the studies vary. There's some studies that say if you have over 50 moles on your body, you're at higher risk. There's some studies that suggest if it's over 15 moles, you're at higher risk. I don't think the actual number is important so much as a general concept. If you have more moles, you want to be a little bit more cautious. That's especially true if your moles are atypical appearing. So atypical moles are moles that look just a little bit funny. They're not melanoma, they are benign, but they're markers that someone with these moles might be at higher risk of skin cancer in the future. And sun exposure is, to me, one of the most important things to talk about because it is an easy risk factor to modify. So the interesting thing about melanoma and sun is most skin cancers are associated with slow, steady, cumulative sun exposure. Melanoma, on top of being associated with that type of sun, has been closely linked with intense, short bursts of sun. The reason that's important is a lot of people will say, well, I'm great with sun protection 80% of the time, 90% of the time, but every year in the summer, I get a little bit lax, I go on vacation, I forget to put on sunscreen, and I get 1 or 2 sunburns a year. That's a problem when you're talking about melanoma risk. There's good studies that show 5 sunburns in your life can double your lifetime risk for melanoma. So really important to be cautious year round. It's especially true if you've got an excessive sun exposure when you're younger. It makes a tremendous difference later on in life. Indoor tanning is terrible for anyone, but especially true for people with a history of skin cancer. My hope is no one listening to this still tans, but there's been multiple studies on this. One study showed that if you tan even once, one session increases your risk of melanoma by 16%. For people who tan for over a year, you may have as much as a 60% increase in your melanoma risk. One other misconception that some people have is getting a base tan at the beginning of the summer will protect me from the sun and from sunburning later on in the summer. And so they've actually looked at that. They did a study where they looked at people who get a base tan who do not sunburn later on and found that these patients still have up to a 4 times elevated risk of melanoma. So base tan's not a good idea. Stay away from indoor tanning completely. So I want to take a second briefly to show a couple pictures of melanoma because I think when most people think of melanoma, this is what they think of. Something that's big, dark, atypical borders, clearly very concerning looking. But melanoma does come in many shapes and sizes. So melanoma that's found on sun-damaged skin, primarily your head and neck, can be a lot more subtle. And so you'll notice during your skin checks, your dermatologist will spend extra time checking the more sun-exposed areas. On the other hand, you can also develop melanoma in areas that have never seen the sun. So there's a reason why you should take your shoes and socks off during every single skin exam. You can develop melanoma below the nails, in between the toes, areas that never see the sun. In people with skin of color, this is likely the most common type of melanoma and what we need to watch out for. Amelanotic melanoma is concerning because there is no pigment. There's no melanin within the skin cancer. And without that pigment, we lose many of the clues that we use as dermatologists to diagnose melanoma. So this can be one of the scarier types because it can be very subtle. All right, so early detection is key. I'm going to go through a few easy steps that you can use, a few little guidelines that you can use and when you're looking at your moles. I realize most people listening to this are probably familiar with the ABCDE rules, so we'll go through this briefly. But the A stands for asymmetry. So if you draw a line right down the middle of the mole, if half of it does not look like the other half, it's a concerning sign. If your borders are irregular, so in this case, part of the borders look eaten away, we call that a scalloped border, that should draw your attention. This particular mole doesn't look too bad in terms of colors. It's just got a couple shades of brown, but if you see red, blue, black, all these abnormal colors, very concerning, go see your dermatologist. If the total size of the mole is greater than 6 millimeters, it's not a hard and fast rule, but it's a little bit more concerning. So worth checking out. To me, out of these 5 rules, the most important by far is evolution. So change over time. This is why I recommend all patients be invested in their own health. Watch your own moles, be aware of where your most atypical moles are, watch them over time. And of course, if any symptoms develop like pain, itching, or bleeding, you want to get in and see your dermatologist right away. So I do recommend self-skin exams for my patients with a history of melanoma. AIM has a fantastic website that will show you in detail how to perform your own skin exam. Great stuff. I recommend everyone check it out. The main idea is you want to look everywhere. So you don't want to skip areas. You want to use mirrors, use the aid of a partner if necessary, look everywhere. And I always tell my patients, use technology to your advantage. Most of us have smartphones nowadays. It's really hard to remember what a particular mole looked like 3 or 4 months ago. So I always recommend take pictures and follow these moles over time. So these are some general guidelines that you can use, but it's still very, very important for you to go in and get your regular skin checks with a dermatologist. How often you do skin checks will depend on a few different factors. So how deep the melanoma was, how recent your melanoma was, but it still surprises me. I still see people occasionally who were diagnosed with melanoma years ago and will come in for the first time since their diagnosis years later. So please make sure if you have friends or family that have been diagnosed, make sure to encourage them to keep all their skin check appointments. Extremely important. Just a couple of helpful tips for getting the most out of your skin checks. So we already talked about why it's important to take your shoes and socks off, remove nail polish, because although it's less common, melanoma can occur in those locations. For men, keeping the facial hair trimmed short gives us a better view. It helps us pick up on subtle changes. Please remove makeup before any skin check. I realize most people are coming, from work or to work on their way to their doctors, but remove makeup because it really does hinder our view and increases the chances that something is missed. So a lot of people ask me, how do we detect melanoma as dermatologists? So I figured I would give you just a little brief insight as to what we look for in our clinic. A lot of it is simple pattern recognition. So dermatologists have trained for 8 years after college, 3 of which are specialized just in dermatology. So a lot of it is just time, training, and looking at a lot of these, okay? But the ugly duckling sign is a useful sign that you can use yourself. So what that means is if one of your moles looks different from all your others, it should draw your attention. Everyone has their own signature or pattern to your moles. So when a patient comes in and shows me an abnormal mole, I will often ask to look at a few of their other moles. If you have a small dark mole, but all your moles look the same way, probably not as concerning. But if one mole looks a little bit different, bring it to your dermatologist's attention. So these are just some examples of melanomas that were picked up on primarily because of the way they look different from all the other moles. Now, in terms of technology, there's a few things that we use, but I think to me, dermoscopy is the most important by far. I think it allows us to pick up skin cancers at earlier stages and avoid unnecessary biopsies. It gives us a little bit more specificity. So in my mind, this is my opinion, but I think it is the most effective tool for early detection of skin cancer. It uses a specialized type of light to show structures that you can't see with the naked eye. It does require special training, so it's not something you can order at home and use to keep an eye on your moles. But I do want to emphasize these are all just tools. So what matters more is the person wielding the tool. There are fantastic dermatologists who do not use dermatoscopes, so a little bit of it is style and preference. But to me, in my clinic, this is absolutely vital. So this is an example of what we see underneath our dermatoscope. This is an obvious melanoma. You don't need a scope to take a look at this, but in some cases, like this one, there were a few subtle clues that if you're trained in dermoscopy, you pick up on that made us biopsy this spot, and it did turn out to be melanoma. Now, I'm not going to get into staging. We don't have the time to do that today, and it's more of a oncology talk, but I'll talk about staging a melanoma very briefly. So there are 4 basic factors, to simplify it a little bit, that determine how advanced the melanoma is. So how deep it is in the skin, whether or not the surface has been eaten away, a process we call ulceration, and whether or not it's spread to the lymph nodes or other parts of the body. The depth is really important. So just to give you an idea, in our clinic, if I had to estimate, I would say probably 90% plus of the melanomas we diagnose are early, stage 0. What that means is they're limited to that topmost layer of skin, the epidermis, and they haven't gone deep. So the prognosis is excellent. Probably another 6 to 8% are thin melanomas. What that means is they're less than 0.75 millimeters in depth. Again, prognosis is fantastic. No lymph node biopsy is needed. I would say probably the rest, 2 to 4%, are a little bit thicker. And in most cases of very thick advanced melanoma, there were warning signs earlier. So please, if I hammer home one thing today, do not skip skin appointments, your skin check appointments. Don't delay evaluation if you see something that is concerning to you. So you want to pick it up when your melanoma is at this stage, when it's nice and early. You don't want to wait until it's a little bit too late. Now, with that said, we have fantastic treatments nowadays compared to 10 or 15 years ago. That's really more the realm of an oncologist, but our treatments have gotten much better over the last 10 or 15 years for metastatic melanoma. So a lot of improvements there. So last part of our talk, I want to spend just a few minutes talking about sunscreen, facts, fiction, myths. Really, really important topic because there is some misinformation out there about sunscreen. But before I do that, I do want to emphasize sunscreen is just a tool. It is one part of an overall sun protective regimen. All right. So putting on sunscreen is not permission to take your shirt off and bake in the sun for 6 hours. All right. You have to be smart about sun protection in other ways. Use hats. Use sun protective clothing, seek out shade. Sunscreen is a tool, but don't use it as a crutch because if you rely on only sunscreen and if you don't use it properly, you will run into problems. So we'll talk about a couple things. One, why is there controversy over how much SPF to use? Why is there not a clear answer? We'll talk about the difference between chemical and physical sunscreens and which one you should choose. And we'll talk about a few safety concerns that have been raised in recent years. So the reason we go into this is I feel a lot of dermatologists don't discuss this with patients. And so a lot of people will go to mainstream media articles, blog posts for information. I think it's important to actually look at the science. So SPF, most people are aware of this. In very basic terms, it measures how much UV light or UVB light is blocked by the sunscreen. Okay, so an SPF of 30 blocks about 97%, an SPF of 15 about 93% of UVB. Most dermatologists, most official guidelines suggest using an SPF of 30 is adequate because it blocks 97% of UV light. The only problem with that is that's based on laboratory testing where a very thick layer of sunscreen is applied. In real life, most people don't apply anywhere near that amount of sunscreen. So if you take an SPF of 30 and you only apply half the amount or a quarter of the amount, you're getting an SPF of about 6 to 15 on your skin. So the corollary is the next question people ask is, well, should we just compensate with doing a higher SPF? Should we just put on an SPF of 100? And the answer to that is it's complicated. And the reason is there are some studies that suggest when people use higher SPF sunscreens, it leads to a false sense of security. More people take riskier behavior. So they'll spend more time in the sun. They won't reapply. They'll spend more time with their shirt off. And so it leads to more high risk behavior that mitigates that small benefit that you get with a higher SPF. right? That is the official line that I think most dermatologists will tell you. I do want to point out, just for the sake of being complete and transparent, there are a couple studies recently that suggest in the real world SPF 100 may be superior to lower SPF. So again, most people will tell you 30 is enough as long as you apply it properly, but I do want to throw this out there just so people are aware. What do I think are reasonable guidelines? I recommend an SPF of at least 30. I think 30 to 50 is a reasonable range to aim for. Look for the words broad spectrum on the bottle. Look for the words water resistant. The two biggest mistakes that I see is people do not remember to reapply every 2 hours, and people don't apply enough sunscreen. All right, so if you can get around those two problems, you're going to make a big difference in how effective your sunscreen is. These are general guidelines for how much sunscreen you should apply to a particular part of your body. Remember that everybody is different. You have different surface areas. There's a lot of variety there. So these are general guidelines only, but if you actually measure it out, you'll be surprised at how much sunscreen is actually required. Again, sunscreen is just a tool. It's an extremely important tool. It's something that you need to use if you have a history of skin cancer, but you also want to pay attention to clothing, hats, shade, and other ways to decrease your risk. All right. We'll talk briefly about chemical versus physical sunscreens. Physical or inorganic sunscreens are titanium or zinc, and chemical or organic sunscreens are basically everything else. So that's the easiest way to differentiate the two. Take your sunscreen, flip the bottle around, look at the active ingredients, and you'll get an idea of what type of sunscreen you're using. So chemical sunscreens are considered to be more cosmetically elegant. They feel better on the skin. They blend better. Most people prefer the way they look on the face, at least. Physical sunscreens are much better for sensitive skin types. There's lower rates of allergic reaction with physical sunscreens, but the problem with these is that they're a lot more opaque. They look very white on the skin, all right? And so the newer ones are a little bit better, but they're still a little bit more opaque than chemical sunscreens. The issues with chemical sunscreens is in recent years, a lot of people have raised concerns about safety and environmental concerns. So I want to make sure we actually look at the studies and not just what your neighbor tells you. So in terms of the FDA studies, in the last 2 years, there have been 2 studies that have been published that suggest with chemical sunscreens, a higher degree of the chemical is absorbed into the bloodstream than we previously realized. Now, I want to emphasize that these studies did not show any harm with that absorption. In fact, the study's authors did not recommend avoiding sunscreen. All right, so this was picked up by a lot of mainstream media outlets and it led to a lot of fear, but I want to be very clear, the studies did not show any clear harm with chemical sunscreens. What the FDA did say is we need a little bit more data, all right? We need more studies to be done. So what I tell my patients is absorption does not necessarily equate risk, and it's a little bit too early to draw conclusions. So we're in a to be determined status. If that bothers you, you have a great alternative. Just use a zinc or titanium-based sunscreen. But I think it's important to know where the actual evidence is at right now. The other thing I want to point out is that zinc physical sunscreens have not been shown to absorb into the body to any significant extent. And the last thing I'll mention is a lot of people, so nowadays, a lot of environmental concerns, you want to be environmentally responsible even as you're protecting your skin from the sun. Oxybenzone is a chemical sunscreen that has been linked to coral reef bleaching, but the issue is it's been linked to coral reef bleaching mostly in laboratory settings. So at a concentration of 30 to 50 parts per million, it can harm the coral reefs. When they looked at the actual concentration of oxybenzone in the waters around Hawaii and the US Virgin Islands, they found the actual concentration was more along the lines of 0.007 to 1.4 parts per million, nowhere near the concentration that was initially tested in that laboratory setting. So what I tell people is the real world data right now is a little bit unclear. There's studies that go both ways. A lot of states have already jumped on this bandwagon and started banning oxybenzone because of the potential risk. I don't think there's clear data that shows that sunscreens have already caused harm, even if there's a potential in the future. If you're concerned and you want to be safe, don't use oxybenzone when you're at the beach. It's a very, very simple fix. The reason I take the time to explain this is there's a lot of nuance here. And I think when you just look at a quick blog post or a quick 2-minute soundbite, you lose all this nuance. So I do want to make sure people understand the real answers are a little bit cloudier, okay? But again, sunscreen is super important. I recommend if you're concerned about any of these issues, just use a physical sunscreen. And last, I'll wrap up with a few common questions that I get from my patients. Do sunscreens expire? Absolutely. Sunscreens do degrade over time. Most of them will last about 3 years, but I do not recommend using sunscreen past the expiration date. Should you wear sunscreen on a cloudy day? There are studies that show some types of UV light does penetrate cloud cover. So if you have a history of melanoma, I do recommend continuing to wear sunscreen. You also get a little bit of penetration through the glass. So you do get diffuse UV exposure even indoors. And one of the more common questions I get is, should I apply sunscreen underneath my clothing? The answer is, it depends on what you're wearing. So it really depends on how densely woven your fabric is. A good rule of thumb is if you hold your shirt up to the light and you can see through it, you are probably getting UV rays through the shirt, and sunscreen should be applied underneath. The other option is you can pick up sun protective clothing online that is a little bit more protective if you're not a huge fan of putting sunscreen on all over. So with that, I'll end for now. I'm going to hand it back to Sam, and then we will take time at the very end to answer any questions that you guys have.